I'm Dr. Sophie Lee. I'm a clinical psychologist and a postdoctoral research fellow here at the Black Dog Institute. The research that I focus on is really trying to understand what causes mental ill health in young people. I actually worked as a clinical psychologist for about 10 years before coming into the research world. And really what motivated me to begin a research career was I felt we didn't have a really strong understanding of what is causing mental illness in young people and the population more broadly. One of the areas of research in mental health that I'm really interested in is understanding the effect sleep has on mental ill health, so things like depression and anxiety. What I discovered working as a clinician is that many clinicians don't prioritise treating sleep or addressing sleep problems in their clients. And one of my, aspirations was really to understand why that wasn't a priority, and also to understand the impact that that was having on things like depression and anxiety, and particularly in young people whose sleep tends to be inadequate, so insufficient sleep and of not adequate quality. Many clinicians don't prioritise addressing sleep problems in young people. We tend to focus on things like depression and anxiety. So the development of the Sleep Ninja smartphone app was really to address that gap in service provision, so to provide young people with a treatment that they could administer to themselves. And what we really hoped by developing Sleep Ninja was we would provide young people with an option to be able to improve their sleep. And we're really hopeful that that would have a flow-on effect to also target depression and anxiety. So Sleep Ninja is a self-administered smartphone app. It is based on the principles of cognitive behavioural therapy for insomnia, which is the gold standard psychological treatment for sleep problems. It uses a gamified element where once the young person completes a training session with the Sleep Ninja, they're awarded a Ninja belt. And the goal is for them to level up as they complete each training session, of which there are 6, until they're a black belt in sleep, so a master of sleep. We found that Sleep Ninja was effective in improving insomnia and depression symptoms in 12 to 16-year-olds, and that was really encouraging. What we know of teenagers is that it's a really vulnerable period for the development of things like depression and anxiety. So we were curious to see whether if we targeted sleep even before that adolescent age range, whether that would have an improved impact in terms of reducing the onset of depression. So what we're doing at the moment is we've adapted and modified Sleep Ninja for 10 to 12-year-olds. It includes a parent component, so the parents can get involved in the treatment, but it's still largely a self-guided intervention for the 10 to 12-year-olds. And we're currently trialling that adapted version of Sleep Ninja in 10 to 12-year-olds to see whether it's effective in reducing insomnia, but also reducing depression symptoms. If you find my research and my work here at Black Dog interesting, please feel free to reach out to me, visit the Black Dog website. We're always happy to talk more about the work that we do here.